Lung cancer is a type of cancer that is usually seen starts in the lungs, where the cells grow rapidly without any division, and it starts to form a mass or a consolidation or a nodule in the lungs, and patient has symptoms regarding cough and everything. The lung cancer are broadly mainly divided into two types. Those are non-small cell lung cancer and small cell lung cancer. So the non-small cell lung cancer have again further division like adenocarcinoma, squamous cell carcinoma, large cell carcinoma. This is the most frequently encountered and most common type of cancer, group of cancers. Then small cell cancer, it is a rare but more aggressive form of lung cancer that rapidly spreads to the body. The other forms are lymphoma, then spindle cell carcinoma, and rare varieties of lung cancers. The lung cancer cause, it is the most common linked is the tobacco chewing or tobacco smoking in any form. Tobacco smoking is reported to be causative agent in almost 85% of cases. The other is the secondhand smoke. The secondhand smoke is also a very risk factor. We usually tend to see the passive smokers. These all are called secondhand smokers who don't actively smoke, but they're exposed to the tobacco smoke, and it is more harmful than the first hand or the primary smoker. Then the occupational exposures in the carcinogenic materials like arsenic, asbestos, and diesel exhaust, these all can also lead to cause lung cancers. Then there may be the role of genetics, like familial history also can play a role of causing lung cancer. And long-term exposures to very toxic fumes or polluted air of industries are also linked to causing the lung cancer. And exposure to radon gas is also reported to cause lung cancers. The patient normally presents, the common symptom is the persistent cough. The cough doesn't go away with, usually the patient visits a general physician. So the cough, and it worsens actually on the progression. So there could be hemoptysis meaning blood in sputum or rust color sputum. Then the patients may experience shortness of breath, that is breathing difficulties, or he may also have wheezing-like episodes, chest pain, discomfort, and there could be unexplained loss of weight and appetite. And patient also has a generalized weakness, fatigue. Some patients may also present as recurrent infections like pneumonia, and there could be difficult, in advanced cases, there could be hoarseness of voice, change of voice, difficulty in swallowing. But the main cardinal features which we see in lung cancers are cough, breathlessness, blood in sputum, and loss of weight. Per se, there is no any specific age group, but the usual prevalence or what we see in our practice and everything, it usually starts from the fifth decade, most commonly, and more common in elderly, around after 60s or 70s of age. And it's more common in males because of more of amount of consumption of tobacco. But there could be, anyone could be affected, and any age group could be affected, although more common in elderly population. Firstly, we need to suspect a case where is having a cough, hemoptysis, weight loss, which is unexplained and prolonged, that is a chronic. There should be some symptoms and everything, or any other symptoms. So after this, then we evaluate usually initially with chest X-rays and blood test. So per se, blood tests don't usually reveal any signs of lung cancer apart from any molecular or cancer screening tests are there if you do. Otherwise, chest X-ray can show you some changes like consolidation or pleural effusion or any mass. Okay, but if it's initial stage, again, chest X-ray is not an answer. Then you need to go to look for the cause and do a CT scan of lungs. So there we can find out the exact anatomy and where all the area is affected. The other is if you detect a area where in CT scan the lung cancer is there or any lymph nodes are there, then you go in those areas, do a bronchoscopy. Then bronchoscopy, you can take samples for biopsy the area and test it for send it for the testing for further examination, histopathology, and further test. Or if there are any lymph nodes positive, then we do a special test called EBUS, that is endobronchial ultrasound guided biopsy. From there, then we can collect the sample, send the tissue for histopathological examination, and we can get answers and get a diagnosis whether lung cancer is there or not there, or differentiate. Any cancer is, you have the stages. The stages usually start from stage 0 to stage 4. So the treatment usually varies from the staging as perspective. If it's very initial stage 0, then you can go and do a surgical option as the surgical option is there. Then you can do a lobectomy or segmentectomy. That much part of the lung is removed if it's very initial stage. Then later stage, still stage 1 or stage 2, we can go for surgeries. Then we have options of chemotherapy. Okay, chemotherapy, we have newer molecules of chemotherapy which are responding very well. After chemotherapy, then we also have what you call targeted therapies, oral drugs, which specifically target the type of cancer. And there is also immunotherapy, which are very newer forms of the, medications available. And we can target the lung cancer cells. And the other option is, if it's a very advanced stage, then there is a aspect of palliative care also, where the motto is to improve the quality of life and relief of symptoms of the patient. There is no particular any step or anything that you can do regularly and prevent a lung cancer. So first of all, you can reduce the risk by avoiding smoking primarily, or avoiding the exposure to secondhand smoke, not sitting in the area where the person is smoking actively. Then wherever you are working, the occupational hazards are there. Then you take a safety measures to use proper safety guards, and the regular screenings after 40s. Then what we have is low dose CT. So we can go for low dose CT scan screening and understand if there is early changes of lung cancer is there.